is 2 p.m. We want to take a moment to welcome everyone this afternoon to our first community of practice for this year. We're going to add a sign-in link to the chat. Please begin to sign in. We're going to give our participants a little time to come on in while we're waiting for a few more of our friends to join us. If you could sign in, we'd greatly appreciate it. Thank you and welcome to our community of practice this afternoon. All right, good afternoon, everyone. We want to ensure that we are honoring everyone's time and starting as on time as possible. My name is Marissa Smith. I am one of the program coordinators here at Healthy SBCSS, and we're honored to be able to be part of this community of practice this afternoon. I'm going to give my team an opportunity to introduce themselves before we get into today's session. So I'm going to pass it over to Ms. Marwa Ahmad.
Good afternoon, everyone. Marwa Ahmad, Community Health System Specialist with San Bernardino County Superintendent of Schools. I'll go ahead and pass it over to Karen.
Hi, good afternoon, everyone. I'm Karen Delatorre, Community Health System Specialist here at SBCSS. I'll pass it to Alex.
Good afternoon, everybody. My name is Alexandra Gonzalez. I'm also Community Health System Specialist with Healthy SBCSS, and I will pass it to Jameen.
Good afternoon. My name is Jermaine Adams. I'm a program technician here at SBCSS.
So that's our little team here at SBCSS, and we want to thank you so much for joining us here this afternoon. If you have just joined us, please use the link in the chat to sign in. We want to thank you for joining us here this afternoon. Just a few housekeeping rules. If you could stay on mute as much as possible so that we can eliminate some of the background noise as we listen to our presenters. We want you to be as interactive as you can. And so if you use your raise hand feature and you have a question, we'll be able to come to you so we can answer your question. I'm sure a question that you have, somebody else has that same question. So feel free to raise your hand and to ask a question. We, of course, also have a Google form for your questions, and Karen will be keeping that updated in the chat as we go along this afternoon. So if you have any questions, feel free to use the link or raise your hand. We want us to be able to listen and learn from each other as much as possible this afternoon. So again, thank you so much for coming. Please use that link to sign on in. All right, just a few updates before we get started. You may have already heard about the Behavioral Health Bridge Grant, so we wanted to make sure that we highlighted that this afternoon. And so there are two priority funding areas: the primary grant priority to prevent any disruption from any of the programs that have already been started at our school site. And the second grant priority is for technical assistance that can be continued. So as of now, our schools that are eligible to be able to apply for this particular grant are schools that are part of cohort 1, 2, and 3. So if your district is a part of the fee schedule for cohort 1, 2, and 3, you are able to apply for this grant. Please take note that the application process will include a letter of intent and an application that must be submitted. And the deadline for that is October 27th. So that deadline is quickly approaching. Karen has added some information to the chat. Some of you may have questions about this bridge grant, just points of clarification that you want to have for this program. There is an email address that is also being added to the chat. Feel free to use that email address to ask SCOE any questions that you may have in reference to this bridge grant. We wanted to make sure that we highlighted it again this afternoon as that deadline is quickly approaching. Again, it is October 27th. And so for any of our LEAs in cohort 1, 2, and 3 that could benefit from these funds, please make sure that you apply for that grant. Next one, Jermaine. All right. Any questions that you may have, again, please feel free to use the link. We will send out this information after our community of practice this afternoon, and so you can use the links that are here in this presentation. All right, last but not least, one more update is RNs are updated on the fee schedule. So they can bill for services. The PPS counselors can bill for certain services. And so this is an update to our fee schedule and people that can bill on the fee schedule. Again, there is a link for all the members at our school sites and within our school districts that can utilize the fee schedule. So if you are not familiar with that, please familiarize yourself with this. Our Life Finder has tons and tons and tons and tons of resources, and we want to make sure that you have access to our Life Finder. We want to make sure that you're looking into our Life Finder and accessing those resources so that you can get any type of help that you may need. Of course, if you ever need anything, feel free to reach out to us here at Healthy SBCSS. We are always here to help. Okay? Any questions on any of our updates so far? All right. All right, so this afternoon for our community of practice, we are super honored to have presenters from 2 of our districts, from the Ontario-Montclair Unified School District and the Upland Unified School District. And this afternoon, as we are all kind of in the trenches of the fee schedule and who we can leverage at our school sites and ways in which we can facilitate movement within our districts, we have 2 of our districts who have been so kind as to be willing to present for us this afternoon. And so for we're going to start with Montclair, Ontario-Montclair Unified School District. Next one, Jameen. And this afternoon, we have with us Cara Molina and Amelia Della Torre from Ontario-Montclair Unified School District. And so we invite them to present to us. First, if you have any questions, please hold your questions towards the end of their presentation. There is a Google form that will be in the chat. And of course, you can feel free to raise your hand and ask any questions that you would like. Okay, so I'm gonna now pass it over to Cara and Amelia. Thank you so very much and welcome to our community of practice space.
Hello, everyone. Cara Molina here. Amelia isn't able to join us at this moment, but I don't believe so unless she snuck in. But I definitely wanted to be able to present to you about what we've been able to do in reference to fee schedule. Next slide. So we historically have been billing for several years. A lot of our school districts are already billing for LEA, BOP, and SMA, but we happen to also have been billing for EPSDD, or early periodic screening, diagnostic, and treatment. That is billing for students that have Medi-Cal and for mental health services. So we have a fully functioning counseling center with licensed clinical therapists that provide services in our district. So because of that experience, we were able to onboard the fee schedule billing program a little bit more quickly, probably than some of our other colleagues in the area. And so we were able to build on what we already knew about billing and add that to our fee schedule billing program. So something that's a little bit unique in our district is we don't use a vendor. We actually have in-house billers for all of those programs. And so when we brought on fee schedule, I hired on two individuals to launch the fee schedule billing program. So that's the way that we started that program. It's been working really well. We're already receiving revenue, very excited. Of course, we're still learning and can't wait to see that revenue dollars like explode. And so it's coming, I'm sure. So some of the practitioners that we use, that we opted to start with, are our school counselors with those PPS credentials. We also have two positions that are considered our community school site coordinators, and they're interchangeable. One's a counselor outreach consultant, and that one happens to have a PPS credential. And then there's the outreach consultant with a teacher credential. Again, similar positions, just two different credentials. So both of those are billing. The PPS, they're billing with the school counselors and the counselor outreach consultants. They have one way of being able to bill under fee schedule. And then our teacher credential outreach consultants are billing as certified wellness coaches. And so we actually took the time to onboard everyone through the process so that they can start billing that way. And then to complement that, we had a couple other positions that could also bill as certified wellness coaches. So one is our classified school family outreach assistant and our student mentors. So all of those first 5 positions that you see on the screen, their primary responsibility is to provide behavioral health services to our students and families. So it was a beautiful blend and mesh of being able to just start billing for the services that they were already providing. In addition, we have a case management team. And so our case managers are also already certified wellness coaches. Of course, right now a student has to be present. So we're actually kind of excited when the community health workers get added, because our case managers do probably better fit as community health workers. But as soon as they get added to the LEA, so we're excited for that to come on board. In addition to help, I do have a team of clinical supervisors and therapists that are licensed clinical social workers and licensed marriage family therapists. And so they're also contributing to the billing. And then coming soon, our nurses, LVNs, health assistants, and then those community health workers will be added. So those are all the practitioners that we opted to start with. With our clinical side of the house, with our clinical supervisors and therapists, and then the nurses, we actually use an electronic health record, so our billers can easily pull through that process for batch claims. And then for our certified wellness coaches and PPS credentialed folks, we have a different process, since that electronic health records that we have is pretty extensive for the clinical perspective. And so we wanted to make the process a little easier. Next slide. So some of the things that we had learned through the process, or things that we had, again, that in-district staffed billing team, we also provided onboarding training and ongoing support to all of our practitioners, whether it be certifications or just best practices. We included the insurance and consent to bill during our enrollment and re-enrollment process, so that our practitioners did not have to worry about that. We did it through our SIS system. Our consent for services are embedded in our current practices. And then our service logs for practitioners, we provided templates, again, for those PPS and certified wellness coaches, and then the electronic health records for licensed. We also provided some service description examples, because what we wanted our practitioners to focus on was continuing to deliver those amazing behavioral health services and not worry so much about the billing side. I'll show you an example in just one moment. And then we're being sure to track by practitioner the logs that are submitted, the service minutes, and how that impacts revenue that's generated, so that we can really see and project what could possibly impact for future continued funding. And then if I could emphasize anything, definitely collaborate with your certificated and classified unions. Having them on board, even though it's not required, is definitely a bonus to help get this launched and going. Next slide. Excuse me. So what we did for our practitioners is we provided them billing service examples, again, focusing on the good work that they're doing. And then that way, when these aren't their logs, but these are their samples that we give them. And then on their logs, the same thing. We just provided drop-down menus so they don't have to worry about the billing codes. But then when those service logs get turned into my medical billing team, then they actually have the codes. They're not having to take time to match up services to codes. Everything's already embedded together so that it just makes the whole process a lot more streamlined. So that is what we did, some milestones we've achieved so far. Again, we're already receiving revenue. I'm happy to share. That was super, super fast, but I'm happy to share or connect with anyone that might have further questions. I've been meeting with a couple of other districts as well.
All right, thank you, Kara. Does anyone have any questions for Kara at this time? Elizabeth, I think you have your hand raised. Do you have a question?
Yes, if I could get my audio to work, sorry. Yeah, so the billable service examples that you provided, did you do this for each practitioner that has a specific group, or did you just do a generic one for everybody, or was it specific to their actual services that they would be rendering?
We did it specific to the services that they render. So our certified wellness coaches, whether they're certificated or classified, pretty much have similar activities. We call them activities, and then matched up to billing codes. And then the same with our PPS. For our clinicians, they're very well versed with billing because, again, like I had shared, we're already billing under those other billing platforms. So they already were very familiar with billing codes and activities that match up. So it was really just working with our PPS credentialed, teacher credentialed, and then classified staff.
Would you be willing to share those examples maybe in the chat so that we can steal them from you?
Sure, yeah, I'll load them right now.
Thank you so much.
Elizabeth, it's helpful borrowing.
Yeah.
Kara, you mentioned your certified wellness coaches, your teachers, and your classified staff. And one of the things that you mentioned was really working with your union. So can you talk a little bit about how did you get those members of your staff to be certified wellness coaches, and then kind of what the partnership with working with your teacher unions kind of looked like?
Definitely. So we provided ongoing training. So on the certified wellness coach side, of course, they needed to become certified wellness coaches, and that's a process, as well as getting their NPI. And then on our PPS side, of course, they needed their NPI. So we actually differentiated our training between those two groups. And then, of course, my clinicals, again, like I said, we didn't have to train them. They were already onboarded. But what we did was we took the time to walk them through step by step with each process to really explain what it means to become a certified wellness coach, what it means to have that 2-year recertification, how we're going to support with professional development. And so we just really wanted them to feel like we were walking side by side with them through this process. And so I do have 2 leads under me that are working with those groups in addition to my actual billing team so that they can be a support to all of those practitioners. And I'm so sorry, I remember the first question. What was the second question?
The second question was in reference to our unions and partnering with the unions.
Yeah, so the reason why we felt it important to partner with the unions is even though behavioral health practitioners, whatever your title is, should be maintaining service logs of supports they're providing to students and families. It might be different in other districts, but in our district with 34 schools, we did not have one required way for them to document those services. We provide them with guidance and support. But they were able to do that a little bit differently. Now, onboarding with fee schedule, there are very specific requirements needed in your service logs. And so because of that, we wanted to make sure that the union and had an understanding of what we were asking, so it didn't feel like it was an out of the box or outlandish impact and effect on their jobs. And so in working with the union, we were able to secure an MOU so that there was understanding by my department, by our practitioners, and by site leaders, so that everybody understood what the expectation was. They were documenting those behavioral health services. We also put in the MOU that all of our practitioners would be allotted of 30 minutes of dedicated time to log those services daily. We know it only takes 10 to 15 minutes, but it's a process and everyone's learning. So we wanted people to feel comfortable. So we included that 30 minutes of dedicated time. And then at the agreement of both the site administrator and the practitioner, if for some reason they just could not get to it that day, there is an understanding that there is a possibility to receive additional compensation up to 30 minutes. So that they can complete those service logs. That's a last case scenario. We really want to make sure that our practitioners are supported with time during their contracted day.
And so thank you for sharing that, Kara, because I feel like that's a very important part of the conversation when we're talking about leveraging individuals that are already at the school site for the certified wellness coaches, and how you are able to provide incentives or support for those individuals so that we can do this work and continue to do this work, because we're already doing it in the classrooms, right? We're already doing it as part of our PBIS initiatives and so forth. And so being able to really reclaim some of that funding so we can continue those supports are really super duper important. Any questions that we may have from members of the group?
I have an additional question for Cara. Cara, this is Antonio from Colton Joint Unified.
Hello, my friend.
Hi, thank you so much for the information. Well done, by the way. Just a quick question. What is, with regards to your school counselors, can you talk a little bit about like how you landed on the documentation process for them? Is it a matter of them, PPS counselors, they have their own standards and their own governing body that they follow. Is it a matter of just kind of taking what they've already been doing and then using that for documentation? You did mention a service log, so is there anything in addition to the service log, or some unique way that they document the services that they provide that you then bill for?
No, great question. And so I think probably important for me to delineate, we have two versions of counselors in our district. We have our dedicated school counselors. We're a PK8 district, so we only go up to middle school. So our middle school counselors. And then we also have our PPS credentialed counselor outreach consultants. So both of those groups are billing. The middle school counselors are more of that traditional type of counselor individuals. And so what they're doing is they are just doing what they normally do, but now they're documenting their services on the service log so that we can bill for those services. The other version is our PPS counselor outreach consultants, and then they're dedicating up to 85% of their contract day in delivering direct services. The nice thing about our PPS counselor outreach consultants is that they can bill for whether it's with student, with family, or consultation with staff, versus those certified wellness coaches can't. And then our counselors are also supporting this entire district effort and billing as well. So the amount that our counselors are billing, it just varies, right? Depending on what kind of counseling services they're providing, what's happening that day, that week, that month. And so their service minutes probably vary a little bit more, where our PPS credential counselor outreach consultants should stay consistent at that 85% marker or more.
Thank you.
Kara, you guys are a well-oiled machine. You have been doing this for a while. Can you share with the group what were maybe some of the initial challenges that you had as a district, And what are some things that you put in place to deal with some of those challenges as our districts are getting started? Just some things that you learned along the way that if you had known, you may not have put your foot in that situation.
Yeah, so I think the biggest one is just always recognizing change isn't easy for everyone. We're all different human beings, and we have to understand that we all come from different places. So the way that I relate that is I love innovation and change, and I'm a systems person, fine tuning. But that doesn't mean everybody is as comfortable as I am with that process. And so now connecting that down to our practitioners, really being mindful and thoughtful of that and how you roll out the training. It was really important. We learned right away not to just say, this is what we're doing to help you, right? Make sure we have these essential positions staying in place, but the why behind it so that they understand we're not doing this to you, we're doing this with you. And actually, it's a great support so that we can continue having these great services in district. So communication, sharing the why behind it, and then but I think we were all in the place where we're learning alongside the state as they're rolling this out. And so being patient. So because I'm okay with change and I love innovation, I'm like, yes, let's do this. So I think, you know, those that have not yet started, I think that's okay. That's probably a good thing because this, you know, we were all learning things as they were rolling this out, and there's been little changes over time. And so just being thoughtful about how you're going to roll out training, how you're going to onboard, and how you're going to support. And then one more thing I would recommend, even though this doesn't impact me because we don't use a vendor, I have in-district billers. I have been talking to districts that are using vendors that they're receiving the service logs, but they're not always well versed with how that matches up to the billing codes. So if you're using a vendor that is not incredibly well versed in fee schedule building connected to activities and services, like providing them a guide. So we provide a guide to our in-house billers, but knowing that not all vendors, like they probably need a guide as well. I was talking to a district today actually who had shared that their particular vendor was receiving all the service logs, but they weren't sure how to code them. And so I thought, oh, they actually used the guide that I put in the chat, that they were going to use that to build on, because every district will use a different set of billing codes. We opted to not use every single code. We're focusing on certain ones, and so matched up to the activities we're doing.
Thank you, Kara. Elizabeth, I think you had a question earlier.
I did, yeah. My question was when it came to insurance collection and FERPA consent. So we're still trying to get it back from the parents to move on to that next step. We're in cohort 4. So we have everything we need going, but we're kind of stuck on that. Was there, you had mentioned that you put it in your enrollment and re-enrollment packets. Was it a requirement for them or was it optional?
A requirement for the families?
Yeah, was the insurance collection a requirement in order to continue enrolling?
Great question. So something very important to point out is we are a district with an incredibly high, low socioeconomic number. And so what that means is we have probably about 85, 86% of our families are either receiving or qualify for Medi-Cal. And if they've shared that with you, it works a little bit differently with Medi-Cal because Medi-Cal, they automatically consent. And so we didn't make it a requirement per se, like no family was penalized for not providing it, but we haven't had any pushback either, because a lot of our families are very familiar with the comprehensive system of care that we have, and they're pretty on board with anything that will help make that continue. And so that was really helpful. So what we did was we did the annual notifications. We put out an annual notifications to parents where it has all the information about what it is, what we're doing. So they had that, and then combined with putting the consent on the enrollment, re-enrollment process. We have electronic and paper versions because not all of our families have electronic. And so we didn't experience difficulty. I will say the most difficulty we have probably is with our private insurance, because they might accidentally put the wrong number or the wrong group, like they'll put the individual number versus the group number. So that takes a little bit of time, but because we're such a high Medi-Cal population, we're grabbing the low-hanging fruit.
Yeah, see, we're actually a high military insurance, and we can't bill for like TRICARE and stuff. So
Yeah.
the ones that do have Medi-Cal or private insurance, we're trying to really emphasize the need, like you said, to support these services that are going. Someone had mentioned the possibility of, in our student information system, as they're enrolling their students, to stop the enrollment process if they don't fill out the insurance information. Like they can't continue enrolling the student if they don't fill that out. And that's what I was wondering, if anyone had even considered if that's like a bad idea to do, to stop that enrollment process, or if that's a good idea. I just, I was concerned.
Yeah, no, we actually did that. So I think it's a great idea, because even you'll still get parents that might put like random information that'll let them go forward. But I think making that a required field is very helpful, because and also, oh, this is a good one that we learned too, is make sure that the automatic response, if they just push forward, isn't no or something that you don't want it to be. Because I want to say our first like automatic response, I think it wasn't on purpose. It was like no, and then we thought we saw a bunch that were indicating no, and then we realized they weren't saying no. It was because it was the option that came up automatically. So being thoughtful about how you have it in your info system, and then making it a required field for sure.
Wonderful. Thank you so much.
Sarah, I think we have a question for you in the Google Forms. Mara?
Yes, so can we review the role of an ORP? Does OMSD use in-district or contracted or ORPs?
Oh, sure. So we actually use in-district ORPs. A lot has to do with, I have a larger than typical clinical staff. And so what we did is, with our PPS credentials, they need an ORP. So we have someone dedicated to them. Then our certified wellness coaches, we have a couple of positions. And so we actually divvied it up. So there are they need a PPS and an ORP. So there's an ORP and PPS team assigned to, like, for example, all the student mentors has one, all of our outreach consultants and school family outreach assistants have another. So yes, we did use in-district ORPs.
Awesome. Before we turn it over to Upland, Kara, just one last question for you. I know that being able to receive our funding from all the work that you guys have done has been an incredible milestone. But what do you feel is a milestone from your district that you think has had the biggest impact?
Before or after receiving revenue?
Either or.
Either or.
I know the revenue is the thing that we all want.
Yeah.
But what else would you consider as like a huge milestone for your district just in doing this work?
Yeah, so I think the huge milestone for us was we were in cohort 2, but so what we did was, last school year, in working with the union, remember we wanted to say that good relationship. So we did agree to just doing a pilot last year. And that was, again, because we wanted to keep intact those union relationships. Because the pilot was successful, the milestone is we were able to roll it out district-wide without interruption for this current school year. So I think that's huge, because had the pilot not gone as well as it did, I imagine we could have faced some pushback. and them being very hesitant to want to move forward district-wide. So that was huge for us, for sure.
Thank you, Kara. We appreciate you so much for just sharing in our community of practice space this afternoon. I'm sure that as people think about some of the things that you've shared, that multiple questions may come your way in the next couple of days or so. But if there's anything that comes up, feel free to reach out to us. We can reach out to Kara on your behalf and get some of those questions answered. So again, Kara, thank you so very much. We really do appreciate it.
Thank you for having me. And we learned just along with everyone else too. So thank you.
All right. Coming right up is our team from Upland. So we'd like to invite the Upland team to our community of practice space. Thank you so very much for joining us. And I'm going to turn it over to the Upland team.
Hi, everyone. Good afternoon. My name is Kara Tofty. I'm a case manager here with Upland Unified. Our director, Mario, Dr. Huckas, is jumping on in here just a minute. He was a little bit double booked. And then I also want to turn it over to Leah to introduce herself from our team.
Hi, everyone. I am Leah Hamamoto. I'm the Behavioral Health Program Manager here with Upland, and I oversee a lot of our clinician and mental health programs. So I'm supporting Kara with the build out of CYBHI in our district. Nice to meet you all.
So, sorry. We can go to the next slide. Oh, we'll go through this really quick. It's very similar. We just kind of wanted to go over our roadmap for CYBHI and then dig into some of our practitioners and how we've rolled that out using our third-party biller and then some of those roadblocks and challenges, but then also those milestones and successes that we've had and some of the best practices or maybe like better practices we've had so far, as well as just a slide of kind of some of the resources and things we've created in-house that we think may also be beneficial just to share with everyone. We can go to the next slide. Thank you. So this was our roadmap. We applied to get into cohort 2 and we were excited. We got accepted. And then one of the things we did is for our billing is we knew we were going to use a third-party vendor or third-party biller. And so we actually did kind of some interviews and we're just meeting with different vendors just to see what might be the best fit for us. And we did end up selecting Healthy Campus. And so I'm trying to think how long we've been kind of officially kind of partnering now. It's been a couple months.
Yeah, definitely a few months now. Oh, and I think Mario just joined us as well.
Wonderful. So Mario can definitely jump in with this. But a lot of the build out then for our platform, and Leah's been working extremely closely with Healthy Campus and can kind of share more of that when we get to that slide. And then also building out just the different trainings for our admin, but then also those practitioners. And then this school year, we've been able to start submitting claims into Healthy Campus. And then Mario, do you want to jump in?
I'll jump in from here. Perfect. I want to thank everybody. I want to start by just thanking Leah and Kara because they have been instrumental in just really building out the systems around kind of where we're going. And if you guys really see the timeline, and I really felt like this was an important part to kind of show that I had this vision when we were first starting that we were going to just like hit the ground running day one of this school year. And probably halfway through summer, really realized that that was not going to be the best route to take as we moved forward with CYBHI, with billing, with transitioning EHRs. There's just so many different levels and it's so complex at so many different places that really had to slow myself down and say like, here's where we're at. And so as we get further into the presentation, we're going to talk about that a little bit. We can go to the next slide, please. We really decided that we had to kind of have a tiered rollout of users. And so we slowed ourselves down. Actually, Leah and Kara slowed me down and said, okay, like, how are we going to do this? Where are we going to go? And so we really started with a phased approach. And this phased approach, because if we don't roll this out the right way, and people run into failures and roadblocks, they're going to just say, see, this doesn't work. This isn't going to happen. And so we were really strategic about the people that we selected to be kind of those guinea pigs in the phase 1 rollout and the phase 1 approach. And so we went with our associate therapist and our trainee interns. And our trainee interns, and we'll talk about this a little bit more in the next slide about how we kind of leverage the certified wellness coach to be able to bill with that group of students or with that group of interns. But we really just used them and we introduced our EHR from day one. So when we onboarded them for this school year, we really said, this is the HR we're using, this is what we're looking for, this is how we're going to do it, and this is the system. And so for the most part, these associates and these therapists don't know any other system. They knew nothing else other than this is what we're using. And so that really allowed us to not fight, well, we used to do it this way and this is what we used to do. So we were really starting with blank slates, and then we were able to say to them, everything isn't going to work perfectly, but here's what we're doing to resolve those issues. Here's what here's where we're moving forward to, and this is our ultimate goal of where we want to go. When we got to the phase 2, and we actually just started phase 2 today, actually, we started with training our case managers that are going to be certified wellness coaches as well as our PPS school counselors, but just 2 specific counselors that sit in a different role than the majority of our other counselors. And so these 2 counselors are housed in 2 of our wellness centers. And so the work that they do is really SEL focused. And so these 2 counselors will be able to give us the perspective of a PPS counselor in the role that they do, but also understand that their role looks a little bit different, that they kind of have some flexibility in the big picture of things of what they're really moving forward with. And so this phase 2 is kind of where we're starting to come across this is how we used to do it, like where are we doing this? And so we're starting to kind of gently ease into this new system without really pushing too hard, because these are kind of our early adopters. These are the ones who see the value. They understand the potential that CYBHI has for just building sustainability within our district. And then our phase 3 is really going to be our wellness center aides, which is a paraprofessional position, as well as our academic school counselors. And I say academic with the quotes because we all know that school counselors, there's no such thing as just the only academic school counselor. School counselors are school counselors, and they work within all of the domains of school counseling. But these are the counselors that traditionally will tell us, I'm an academic counselor. And so really looking at where they sit in this work. And we really know that these academic school counselors are going to be our ones that we're going to have to kind of guide and go with the most kind of gloved hands with them. And so we want to make sure that our system is as built out and bug free as possible so that they experience the least amount of resistance in the program side of things and in what the billing looks like, so that we have the highest chance of success with them so that they can have the most buy-in when that point comes. Next slide, please. So certified wellness coaches, we've been anticipating them officially being on the fee schedule for as long as I have known about the fee schedule. It really was a position that really kind of lived in limbo with, here's the things that we think they can do, here's what we're anticipating to do. There was a long list of things, and they were taken completely off the draft fee schedule, and then they were put on again. And so really kind of, for me, they kind of fell in this position. The certified wellness coach really fell into a place that we saw a few different applications of this certification. And so the first place that we really saw it coming in was with our wellness center aides. And so our wellness center aides are paraprofessionals that are stationed within our school-based our school site wellness centers. And so these wellness center aides do intakes as far as like when students need breaks from the classroom. They really serve like a surface level support and do mostly data collection and mostly kind of guided support to students under the supervision of a PPS school counselor. And so these ones really came down to, we already had the position, we already had the people. So we were just looking, and we talked to all of our wellness center aides and said, do you have an associate's? How many years have you been doing this? And so we looked about a certification that is either the work experience or the education, just depending on how long they've been in the district doing this work. And so we got about 75% of our paraprofessionals that are in that role that met the criteria, and we supported and helped them through getting the certified wellness coach certification. The next group of people were our case managers. And so our case managers do a lot of the work. And in just their title of case management, they really fall into a place where they're doing intakes, where they're kind of connecting to resources, and they fit very, very perfectly into the work and into the description of everything we saw that certified wellness coaches would fall in. And they meet with a lot of our most vulnerable populations of students. And so we really are looking at leveraging the work that they do and that they're already doing and just seeing where it fits into that fee schedule. And then our last place is where we kind of had to get the most creative. And that was with our MFT trainees and our MSW interns. And so it's really interesting that the fee schedule has a place for licensed practitioners, and it has a place for licensed or for pre-licensed or registered associates, but there wasn't a place where our trainees, and I would, argue with a lot of people and say, these trainees, they have a lot of skills. I would say they have more skills than some of our certified wellness coaches, or they have, a different set of skills, but a more clinical skills than even our PPS counselors might have in some instances. And so we really were looking for a way that we could leverage this group of interns, because we have 10 trainees right now, and then also one MSW intern. And so I felt like we were leaving money and opportunities to bill on the table without having them on the fee schedule. And so when we looked at the certificate, or we looked at the criteria for the certified wellness coach, we really felt like a lot of the work that they're doing fits within that. And most of them have that training. Now, not all of them, because some of them come from a background that isn't a bachelor's in a psychology or child development. They come from other places, or even if they were out of state, those hours and work that they did there didn't count, but it's more than we had. And so we were able to get, Leah, how many of our trainees are certified wellness coaches?
I believe only 3 out of the 10 aren't. So we have 7 right now.
So we have 7 of our 10 trainees that meet that criteria, and the other ones will get it before the year is over, just by having the experience and the hours that they're going to be providing services within our district. And so that is coming. And so we were able to really leverage a position that was not bringing in any revenue in the past, that they're actually the ones right now that have been piloting and really pushing this work forward and showing us the successes as we went with that. Leah or Kara, do you guys have anything to add with the certified wellness coach piece? All right, I did an amazing job. Next slide. There were some roadblocks and there were some challenges, 100%. Like I said, I had this idealistic, like I did the calculation, and Kara laughed. She's like, you need those sunglasses with like the dollar signs, because when I look at like services, like that's what I think. I was like, is it billable? What can we do? How is this going to work?
They didn't want 2 school districts talking.
All right. And so one of the biggest things that we kind of came up across was the consent to treat and the consent to bill. We really, really, really needed to be strategic about how we kind of launched that. And we had this idea that we were going to do it in our school data confirmation. We were going to just roll it out there, and that was going to be where it went. And then we ran into some other kind of roadblocks that came with that. There was a different climate in dealing with some of our families that may be undocumented, or there may be some questions like that, and adding that into that adding that piece into our data confirmation, we were worried that it was going to cause people to not complete the data confirmation. And so we really just wanted to reduce that opportunity, or like reduce that barrier. And so we just took it off. And right now we're currently just kind of asking for this consent on an individual basis as we work with our trainees and our associates to start to bill and as they do their intakes with clients. And so that's the main place that we've gone. The other piece is obtaining health insurance information. Some of our families will have their Medi-Cal eligibility card, but not their provider card. And then at first we were required to have a picture of front and back of the card, and now we don't require that. And where are we entering it and is it accurate? And so just kind of the messaging that goes with asking people for some very private and personal information. We really have worked hard as a team to make sure that everybody at the school site level understands this before we ask everybody for this information. Because if my kid's school is asking me for this and I call the school and they don't know why or what, or they can't explain it, I'm not going to do it because I don't trust them. They don't know who we are as a support services department. So I'm going slower than we thought, but we're actually, I think, gonna do so much better when we get to it because we've laid such a strong foundation of understanding. We're creating videos, we're creating a variety of different ways for families to be informed. We're partnering with an organization that says, hey, like we can bring a breakfast or a food truck in and we can do some like face-to-face conversations with families. And so those are the kinds of things that we want to do to really build understanding and get over these challenges and roadblocks. Next slide, please. We've had some successes and we've had some great milestones. And so if you look here, you'll see that we have just at the top part really had some district-wide staff awareness about CYBHI. I met with principals a week ago and I said, who knows what CYBHI stands for? And about 3/4 of them knew what it stood for. I asked our counselors when I met with our counselor collab the same question. So there's an awareness and an understanding of what we're doing and why we're doing it. And so that has been a huge, huge piece of that. Some people call it chibi, like they know what it is and they know what I'm talking about when I get to that. And then our district and executive cabinet, they support this initiative. They know the importance and the potential that this has to really create a source of revenue, to create some sustainability within the work that we're doing. Our billable claims submitted as of last week was a little over $13,000, which going from nothing to that is a huge, huge, huge place. We have 33 users right now that are trained within the platform that we're using, which is Healthy Campus. And then we've had 181 sessions that have been billable claims that we've been able to do. And so this has been a huge success for us and a huge place for us to be able to continue to move forward with that momentum. Next slide. Some of our best practices that we really talked about, and I think this is kind of a recap of a lot of the things that I already shared, but really that phased implementation with a testing pilot, going in slow to go fast. And I know it sounds really cliche to say, but it is the only way to make something like this happen at such a large system. And I think the other fact that so many things are still unknown that we from DHCS, we're still getting, we're not sure, and maybe, and we'll tell you in a couple of weeks. The slower we go with this, the more definite and the less changes we have to make and tell people like, oh, we said this last week, but this week this is something different. I think front loading people with that as well, having clear communication, and when change happens, how are we communicating that in a systematic way to everybody? Are there cascading communications? Are there ways that we're able to share that with everybody in a clear way so that there's understanding at all levels from all people that deal with this, whether that's people that answer phones, whether that's people that are entering billing and doing that, we want to make sure that that's clear. Making sure that there's comprehensive training and ongoing support. That is key, making sure that people know what they're doing and why they're doing it. Just outlining billable activities for each CYBHI provider role. We spent time looking at what do you already do in your day-to-day? Like what is we're not adding anything to your role. What do you already do? And where does that fit into the fee schedule was a much, much better approach than saying, here's the fee schedule, here's the things you're going to do different, and just moving everybody's like day around was not at all what we were looking for. And then lastly, just looking at the data integrity, the compliance, and the workflow alignment, making sure that that we are being mindful and thoughtful about how we're collecting data, making sure that things are that are HIPAA and FERPA, that where they fall and where they go, making sure that we're doing right by the personal information that our families are entrusting us with. And what are we doing to maintain the integrity of that privacy, but also how are we using that to benefit all of our families as they move forward? Next slide, please. And these are the link to our resources. We really feel that we have taken a lot from other people and we've learned a lot from other districts and other places, and we want to be able to share that with us. And so this is clickable of things that you can have. On the next slide, it has our contact information. You are more than welcome to reach out to me or Kara. You can call support services. Leah's the counseling center down there. We are available to meet, to talk, to really work through and share our experiences that we've had. All right. Thank you guys so much.
Thank you, Mario. Thank you to the Upland team for being part of our community of practice for today. I don't know if we have any quick questions from anyone, but Mario, just really quickly, as you guys were beginning to build your program and begin to implement, kind of who in your district were kind of the initial members that you utilized in putting this process together, and how as our districts continue to build their system of support, any kind of best practices as to who needs to be involved in this conversation at the initial?
So I think that for me, one of the things that I think has been so beneficial to our build out is that under the umbrella of support services lives the mental health support side of things. So Leah's team is there, and then our case management side with Kara and the case managers there, as well as just Kara's expertise in systems building. And so I think that was one of the big things is I've got the ideas and I've got a lot of things going on in my head. And sitting down with somebody like Kara and Leah who say like, okay, but what's the standard operating procedure? But what's the form look like? What does this look like? And really being able to dig into the technical side was really, really beneficial. And then really at the highest level of leadership, our superintendent and our board and executive cabinet, understanding the needs that we had around making sure that communications were out, making sure that people were on board with who we had to hire or what are the systems that we had to move forward with in those partnerships. And then also we partnered with Healthy Campus and just kind of the vision of what that EHR looked like. And they have been really, really responsive with their platform. When we see something that we're like, hey, we're not sure about that, or we're not sure how that's happening, being able to make those shifts with them has been a really, really like powerful part of that.
Thank you so much. A milestone. Not just that you're able to now build for funding, because of course that's all of our primary, right? But two things. What's a milestone? And if we don't all have a Leah and Kara, what's our plan for your plan to get the word out to the educators for whom this conversation is so left field for us because it's not our wheelhouse? So if we don't have a Kara and Leah, what's your plan for getting the word out? And then what's a milestone that you guys have accomplished?
So I would say that our milestone is when I arrived in our district 3 years ago, we had wait lists of students to receive behavioral health supports that were kind of endless. We didn't really have a plan on how to support all of these students. We had one intern and students we were paying for outside providers to provide services. And this year and last year, we have paid zero to outside providers, and we've been able to maintain no wait list for our students to receive short-term and long-term care when it comes to mental health support. So definitely, I would say that is a huge milestone. And the CYBHI program is just going to continue to allow us to create sustainable systems that will allow us to always maintain that no wait list and just be able to provide students with the supports they need when they need them. So hats off to my team who's really created that and been a big part of developing that part. And then I would say that the biggest way to get the word out is just by talking to people. By every chance or opportunity you get to say the word CYBHI, Child and Youth Behavioral Health Initiative, that is really, people will start to kind of figure it out. There's a lot of great videos. There's a lot of great information out there, flyers. We have some FAQs. If you guys want to take those and format them and put your district logo on that, you guys are more than welcome to do that. there's a lot out there when it comes to that. And so I would say just the more you talk to people about this initiative, and I talk to people like in my own community, not even where I work with my own kids. I'm like, did you know that? And I always tell people, this is my kind of sales pitch that I have for it. I have 4 kids, and one of my daughters sees a therapist on a regular basis, and it costs me $25 for every session that she attends. And so if she goes 4 times a month, once a week, that's $100 a month. And so for a lot of our families, that $100 a month is gas money, it's their phone bill, it's their groceries, it's a lot of different things that a lot of our families cannot afford. And so if we're able to provide that as a school district for free with no cost, with no impact to their insurance or their deductibles, what a huge, huge opportunity that we have to just really meet the needs of so many of our families, whether that is their mental health needs or we're allowing them to get the supports for their mental health and not have to sacrifice anything for that. So I say that's one of the biggest kind of pitches that I give to anybody that I talk to about this, and it really is a powerful way to show the impact that this initiative has.
Thank you so very much, Mario. I think Mario kind of wrapped up our session really beautifully for us this afternoon with that elevator pitch, right? And as educators, we do what's best for our students every single day, and we get in the trenches. And it went from us not knowing how we were going to get this fee schedule to even work to now having various experts just right here in our room that are giving us little tips and little nuggets of ways that we can support the system, support our students, support our families, and ultimately support our community here in San Bernardino to ensure that we're having a healthy community. So thank you all for coming out this afternoon. Thank you to OMSD and Upland for being willing to be part of our community of practice and share their best practices with us this afternoon. We appreciate you guys so much. If there's ever anything that you need, feel free to reach out to the Healthy SBCSS team. Our manager slipped on towards the middle, and so we want to make sure we recognize James Soward and say Happy Bosses Day to him in this public space. To any of the other bosses that are online with us this afternoon, we appreciate you and thank you guys so very much. And last shameless plug, our Wellness Center tours happen October 22nd. So if you would be like to be part of our Wellness Center tours, we are featuring Rialto Carter High School, and we're featuring one of our charter schools for our wellness tours. Again, thank you all so very much and have a great rest of your afternoon.